Hello, this is Dr. Susan Mara with Dr. Mara's Medical Minutes, and today we're going to talk about Babesia. Babesia is an intracellular red blood cell parasite that is frequently a co-infection of Lyme disease and can cause you to feel severely ill. It is related to malaria. In other words, if this is the equator, below the equator is malaria, and above the equator is Babesia. You use the same drugs to treat them, and the antimalarials such as Mepron, Malarone, Alinea, Coartem, and because they are co-infections of Lyme disease, they just wreak havoc. And some of the symptoms that are typically characteristic of a Babesia infection are severe headache. You feel like there's a band around your head like this, shortness of breath or air hunger. Sometimes you can have a fever. Sometimes you can have joint swelling. You can have sort of chest discomfort, from the shortness of breath and the Babesia. And you have a general malaise with Babesia that it just makes the entire infectious situation much, much worse. There are several species that cause infection, but the ones that we can measure are Babesia microtii, which 20 years ago used to be the East Coast version. Babesia duncani, 20 years ago, that used to be the West Coast version. And Babesia divergens, which used to be the European version. Now, all of these species are all over the place because they are in ticks that attach to migratory birds, and they are moved all around the place. So Babesia is a very, very big deal. You have to get rid of that infection in order to heal a complex chronic illness patient. You generally need to use more than one antibiotic and herb. Not even antibiotic, sorry, anti-parasitic, because Babesia is a parasite. So you can use tefenaquine with Malarone. You can use Dapsone with Doxy, Rifampin, and Zithromax. That's what Dr. Horowitz does. And you can use Mepron. You can use Malarone. There's a whole host of things. And the herbs that are really good for Babesia, black walnut, wormwood, artemisinin, and there are several herbal concoctions, largely made by Beyond Balance, that are really good for Babesia, Bab 1, 2, and 3. There is one by Lymecore, which is called Babcore, I believe. And then there is one by Byron White called ABAB. Just because they're herbs doesn't mean that you're not going to have a severe Herxheimer. Generally, when you have Babesia, we see it aggravate the Herxheimer. So you have to start low and go slow. And that's largely the best philosophy for treating any of these infections with either herbs or antibiotics or both. In my practice, I choose to treat largely with an integrated medicine approach that utilizes the best of antiparasitics and herbals. So everybody is different with regards to how long that it needs to be treated, but Babesia is definitely a difficult infection to get rid of. And it seems to be getting more and more difficult. I think it's developing resistance to medications. So I hope that you find this information useful, And I hope that you find a true and authentic Lyme literate doctor who can help you identify the infections that you have and then treat them appropriately. Thank you. Have a wonderful day.